When it comes to a diagnosis like cancer, it's important to know what your treatment options are. Today, we're joined by radiation oncologist Dr. Matthew Boyer from GBMC Hospital, who is here to tell us more. Well, welcome.
Welcome.
Thank you for being here with us today.
Thank you.
All right, so a lot of people hear cancer, but they may not know what the term metastatic means. What is it?
So metastatic really means a cancer that started in one part of the body and is spread to another part.
Okay, and so what factors determine, I guess, what kind of treatment that you're offered once you have metastatic cancer?
Well, the way that we think about metastatic cancer these days is we tend to break it up into different populations of patients. And the distinction for that is a little bit of a fuzzy line, but generally what we're looking for when we use radiation to treat metastatic patients are a limited number of metastatic tumors.
Okay.
So cancer does not spread to many sites beyond where it started.
Okay, so what does the radiation do? It just kind of hones in on the problem?
Sure. Well, you know, a lot of people have had an X-ray or a CT scan at some point in their life. Getting the radiation treatment for cancer is very similar.
Okay.
You lay on a table and we're directed the radiation, the X-rays actually at the tumor itself.
Okay. And so how long is each treatment?
Treatment themselves, you probably would be in our department for about 30 or 40 minutes each time. And you're laying on the table where you get the treatment for just about 15 minutes.
Okay, so it seems like a pretty good option, right? And
Yes.
is how many days, how often do people need to have this treatment?
So that can vary by the cancer type that we're treating. But for
Okay.
most patients with a metastatic cancer, they're typically getting treated over about 5 days. And so it's a relatively quick treatment that we give compared to the months that some patients can be on chemotherapy.
Okay, so can you talk to us again, let me just rewind a little bit, to talking about metastatic cancer and then having a cancer that has not metastasized. Can you explain?
Sure. So I think it's, you know, we think about cancer, sometimes we've heard about different stages, so stage 1, 2, or 3, 4.
Okay.
I think in the framework for this, we can think of an early stage cancer. So those are the patients we want to find. We want to do mammograms and colonoscopies to find those cancers early. Some patients, unfortunately, will present with a little more advanced cancer, a locally advanced cancer that maybe has spread to some lymph nodes or has grown particularly big where it started. And then after that is the metastatic disease, where it started in, let's say, the lung and now spread to the liver or the bones.
Okay.
You know, these patients that we hope to treat with radiation have a limited number of sites of where the cancer has spread to.
Okay. So are there certain types of cancer that are more likely to spread?
Yeah, so certainly breast and prostate are the most common types of cancer in men and women. And those tend to have a very long history when they do spread. And they tend to have a very slow progression. And so those are certainly cancers that we can treat with radiation.
Okay, so when we talk about radiation, what are some of the benefits?
Well, certainly the benefits have been shown thus far is that it can delay how fast the cancer will progress.
Okay.
It's even shown, you know, for some subset of patients to improve how long they live after they've gotten treatment.
Okay, are there any side effects?
It's a little bit dependent on exactly where we're treating. So, you know, for example, when we are treating somebody in their lung, you know, it is possible they could get some cough with the treatment, not right away, but down the road. We can aggravate their esophagus, so they could get a heartburn type sensation along with it. But these are generally temporary, mild, and go away pretty quickly.
Okay, and so somebody realizes that they have some kind of cancer that is metastatic, right? So they come to you, and so what happens from the beginning when they walk into your office? Kind of walk us through it.
Well, so we really try to take a multidisciplinary approach.
Okay.
So typically the patient that we see has already seen a surgeon, possibly, and almost certainly a medical oncologist. So we like to kind of integrate the treatment that we do along with the chemotherapy that they may have already started receiving or to receive in the future. But the process is we would, you know, consult them, talk to them about what we know so far from the workup and evaluation that they've had. I mean, that can include things like a biopsy or staging scans like a PET scan or a CT scan, and come up with a plan that makes sense for them in terms of how we should treat this.
So I think a lot of people, when they hear cancer, it's scary, right? Then you hear chemotherapy, radiation, it's scary. So how do people respond when they finish their treatment? Do they tell you, that wasn't so bad?
A lot of times, yes. So when patients do finish their treatments, it's a little bit of a tradition in a lot of different places to have them ring the bell to kind of celebrate. We give everybody a diploma when they're done. But a lot of the anxiety is just sort of the unknown. It's not, you know, most people understand what it is to take a pill or maybe even be in the hospital. But the radiation is a little bit of an unknown for most people. And they typically say that it was very simple. They just have to come in, kind of lay down like they do when they get a CT scan or an X-ray, and then the treatment's done very quickly.
So are people surprised when they come in how, I mean, not easy, but how kind of not as painful as they thought it would be, it is.
Sure. I think when people think about cancer treatment, they think often about the side effects that go along with chemotherapy. And chemotherapy is something that it's a necessary evil, so to speak, and that it's something that you usually get through an IV that goes throughout your body, can cause a lot of different side effects.
Right.
But when we do radiation for this type of cancer, or this cancer that's spread in this way, we're targeting one particular spot or a couple spots, and the side effects are really very minimal.
All right, so thank you so much, Dr. Boyer. If somebody wants to get in touch with you, where do they go?
So the easiest way is to call us in our department directly. Our number down there is 443-849-2540. Or certainly can look us up on the GBM website. I think on the website,
It's
I think
on
the screen, it's on the screen now. And in either way, we'd be able to get you in very quickly and discuss what the options are.
All right, well, Dr. Boyer, thank you so much for joining us here today. And again, all that information, they're available on your screen, and will also be on our website as well. Thank you.
Thank you.